Welcome back. This is Maddie. We are in the third video clip, part 2. So previously, we just went over the 3 medical conditions that are addressed in the advance directive under the living will section. So now we're going to talk about your treatment options. So the treatment options are the same for any or all of the 3 conditions. So the first one, your first option for care, if you were ever to be in one of those conditions, would be to be kept comfortable and allow natural death to occur. You do not want any medical interventions used to try to extend your life at that time, and you do not want to receive nutrition and fluids by tube or other means. The second option talks about being kept comfortable and allowing natural death to occur. You do not want medical interventions used to try to extend your life at that time, but if you were unable to take enough nourishment by mouth, however, you would want to receive nutrition and fluids by tube or other medical means. The third option says try to extend your life for as long as possible using all available medical interventions that in reasonable medical judgment would prevent or delay your death. If I am unable to take enough nourishment by mouth, I want to receive nutrition and fluids by tube or other medical means. So I just want to explain the fluids and nutrition by other medical means would include things like IV fluids or artificial nutrition given by a tube inserted in your nose or surgically inserted to your belly. They can give liquid nourishment that way, or even sometimes by IV. So those are what those options might include. So I just want to let you guys know that whatever option you want, you should put your initials next to as far as care goes. If for any reason you can't make a decision about one or two or any of them, you can leave it blank. If you only know for certain that you want a certain treatment for a certain condition, certainly fill that out by initialing it. And I would say anything you couldn't make a decision on, it's probably best just to kind of draw a slash through it so nobody can come through, not that anybody would, but if there would be no questions as to that you just did not make a decision about that treatment option. And that doesn't invalidate the document. You can make any or all decisions you want. So just keep that in mind when you're filling out this document. So we talked about the 3 conditions. We've talked about your treatment options. On page 7, it talks about a number E, pain relief, no matter what my condition, give me medicine or other treatment I need to relieve pain. You can put your initials next to that if that is something that you would want. The next section talks about in case of pregnancy. That seldom is a concern, but if you are a young woman filling out this document now, you could certainly put in any input you would want, any advice, any kind of decisions that you think you could make now about the future if you were in those conditions and you were pregnant. Part G, this is the bottom of page 7, talks about the effect of your stated preferences. And this comes up a lot because people will often say, can my family, can my doctors, can anybody change my advance directive? So the first part of the advance directive, of course, is the healthcare agents, and nobody can change that. Only you can designate those people. When it comes to the living will, this is your opportunity to let us know if you want your family or your healthcare agents to be able to make changes to your choices or not. So option 1 says that although you cannot foresee everything that might happen after you can no longer make your own decisions, your stated preferences are meant to guide whoever is making decisions on my behalf and my healthcare providers, but you authorize them to be flexible in applying these statements if they feel that doing so would be in your best interest. So if you initial that option, you are actually saying, yes, my healthcare agent can take my choices as guidance and preferences, but if they truly think that doing something else is in my best interest, they have the authority to do that. Or 2, I realize I cannot foresee everything that might happen after I can no longer decide for myself. Still, I want whoever is making decisions on my behalf and my healthcare providers to follow my stated preferences exactly as written, even if they think that some alternative is better. So if you were to initial that option, you're saying that with regard to those 3 medical conditions, whatever choices you made is what you would want your family and your healthcare providers to follow. So I hope that kind of clears that up. And again, these documents are invaluable for many reasons we talked about early on in the introduction. However, we can only use them if the criteria fits. As long as you're able to make your own decisions and speak for yourself, it doesn't really matter what these say because you are the decision maker. We can only use these documents, A, if you can no longer make your own decisions or you don't want to make your own decisions, and then we're going to see who those people would be to speak for you. And as far as the living will, only if you're designated and certified to be in those conditions can we follow your instructions. So it doesn't apply to most everyday things. And that is the end of the living will. So that's the end of page 7. The next video clip will talk about the signature and witnesses and what to do with your advance directive when you're done. So thank you very much for watching this video, and we'll talk again soon. Bye.